Good morning, my name is Asha Thomas. Clinical teaching topic, chest physiotherapy. Introduction. Chest physiotherapy is a group of therapies for mobilizing pulmonary secretions. The therapies include chest percussion, vibration and postural drainage. Chest physiotherapy is followed by productive cuffing or suctioning of a patient who has a discrete ability to cuff. This is especially helpful for patients with large amount of secretions or ineffective cuff. Now the indications. It is indicated for patient if home cuff is insufficient to clear thick tenacious or localized secretions, example cystic fibrosis, bronchiectasis, atelectasis, lung abscess, pneumonia. Contraindications: increased intracranial pressure, unstable head or neck injury, active hemorrhage or hemoptysis, recent spinal injury, rib fracture, flail chest, uncontrolled hypertension, anticoagulation, thoracic surgeries. Now, assessment for chest physiotherapy. Assess the vital signs. Know the patient's medications. Certain medication, particularly diuretics, antihypertensives, cause fluid and hemolytic changes. This decreases patient's tolerance to positional changes and postural drainage. Assess for any condition. Assess for any contraindication. Perform detailed physical examination of the chest. Review the patient's X-ray and other blood investigations. Now coming on with the techniques in chest physiotherapy. Chest physiotherapy consists of 3 techniques. First is the percussion, also known as clapping or cupping. Second is the vibration. Third is the postural drainage. So first, starting on with the first, percussion or clapping or cupping. Chest percussion involves rhythmically clapping on the chest wall over the area behind drained to force secretions into larger airways for expectoration. Position the hand such that the fingers and thumb touch and the hand are cupped. Perform chest percussion by vigorously striking the chest wall alternately with cupped hands. The procedure should produce a hollow sound and sound not be painful. Perform percussion over single layer of clothing, not over buttons or zippers. Percussion is contraindicated in patients with bleeding disorder, osteoporosis, fractured ribs and open wound and surgeries. Do not percuss over the spine, sternum, stomach or lower back as trauma can occur to the spleen, liver or kidneys. Typically, each area is percussed for 30 to 60 seconds several times a day. Now coming on with the vibration. Vibration is a gentle shaking pressure applied to the chest wall to move secretions into larger airways. The nurse uses rhythmic contraction and relaxation of arm and shoulder muscles over the patient's chest. During vibration, place your hand against the chest wall on the appropriate lung segment to be drained. Now vibrate the chest wall as the patient exhales slowly through the pursed lips. After each vibration, encourage the client to cough and expectorate secretion into the sputum container. Now, postural drainage. It is a technique in which different positions are assumed to facilitate the drainage of secretions from the bronchial airways. Gravity helps to move the secretions into the trachea to be cuffed up easily. The goal of postural drainage is to drain mucus from the affected lobes into the larger airways of the lungs so it can be cuffed up more readily. All the patients do not require postural drainage for all the lung segments. So, the procedure must be based on the clinical findings. Intercostal drainage, the person is tilted or propped up at an angle to help drain secretions from the lungs. The lower lobes require drainage most frequently because the upper lobe drains by gravity. Before postural drainage, the client may be given a bronchodilator medication for nebulization therapy to loosen secretions. Postural drainage treatments are scheduled 2 to 3 times daily depending on the degree of lung congestion. The best is to include before breakfast, before lunch, and in late afternoon and before bedtime. It is best to avoid shortly after meals. Postural drainage at these times can be tiring and can induce vomiting. Help the patient to assume the appropriate position based on the lung field that requires drainage. Postural drainage and position recommended. First position is apical areas of the upper lobes. The position recommended is ask the patient to sit at the edge of the bed. If the patient is not able to sit at the edge of the bed, use high Fowler's position. For posterior secretion of upper lobes, position recommended is position supine with a pillow under the hips and flexed knees. Now for middle or lower lobes, position recommended with the bed in the Tenderberg's position. Position the patient in Sims position to drain the left lung. Position the patient on his right side. Now for posterior lower lobes, position recommended is keeping the bed flat. Position the patient prone with a pillow under her stomach. After positioning the patient, remain in the desired position for 10 to 15 minutes if tolerated. Perform percussion and vibration by keeping the client in position. The sequence for chest physiotherapy is usually as follows: positioning, percussion, vibration, removal of secretions by cuffing or suction. The last procedure is documentation. Following chest physiotherapy, the nurse should auscultate the client's lungs, compare the finding to the baseline data, and recommend the amount, color, and character of expectorated secretions. Thank you.